Adelaide researchers are working on a genetic test that could change the way chronic pain relief is managed by patients with spinal cord injuries. Funded by the US Defence Department, the world-first trial may lead to tailor-made treatments.
30-year-old Henry Bucket has spent the past 2 years in a wheelchair.
I have a complete T2 spinal injury, so I have no feeling or motor control under about the level of my armpits.
The Hackney father snapped his spinal cord in a motorbike accident and now lives in chronic pain.
Yeah, I get severe episodes of neuropathic pain, which I can only really describe as searing and mind-numbing, and that's from the level of my injury down.
2/3 of patients with spinal cord injuries develop chronic pain later in life. Researchers at the University of Adelaide are now looking at their DNA and comparing it with other chronic pain sufferers.
We're trying to understand whether the genetics of somebody with spinal cord injury contributes to how much pain that they get later on in life.
They also believe some pain relief, like morphine, could exacerbate the problem long term, and they're developing a genetic test to determine what drugs would work best based on a patient's DNA.
If we can tweak the types of treatment we do at injury by understanding the genetics behind chronic pain, we can actually make lives much, much better.
Initial results from the clinical trials are likely to be released in the next 12 months, with the genetic test potentially available in 3 years' time.
It would be wonderful to try and find a way of helping that for myself, but also it affects a lot of people.
To volunteer, contact this number. Jessica Stanley, 9 News.